Hello, my name is Morgan Turner. Today I'm going to be completing a full head-to-toe assessment for East Tennessee State University, NRSC 2030, Section 970. I'm going to do a quick 360 of the room before I get started. I'm washing my hands. Hi, my name is Morgan, and today I'm going to be completing a full head-to-toe assessment on you. I'm going to be examining your skin, your heart, your lungs, and your abdomen. Do you have any questions or concerns?
No.
Okay, if you could verify your name and date of birth for me.
Austin Turner, 12/22/94.
Okay, and tell me where we are right now.
Bristol,
Okay, and what is the month and the year?
July 2022.
Okay, my patient is alert and oriented ×3. Okay, the next thing I'm going to do is assess your blood pressure. I'm going to go ahead and place this pillow under your arm, and this is to get your arm as close to heart level as possible. Today I'm using a manual blood pressure cuff. Alright. Okay, blood pressure today is 96/68. Okay. We'll take this pillow for you. Okay, the next thing I'm going to do is a quick assessment of your skin. If you would pull the legs of your pants up for me and kind of roll your sleeves up. Okay, as I begin to inspect the patient's skin, I can see that it is appropriate for ethnicity. As I compare the arms and the legs, I can see that there are some darkened areas exposed to sun, but there's no apparent lesions. I don't see any prominent redness or inflammation. Okay, so if you'll hold your arm out for me, I'm going to look at your nails. I see that there's no clubbing noted and the nail angle is appropriate. The nail beds are attached. They are smooth and clear. As I check the capillary refill, I see that it is brisk in less than 3 seconds. And that occurs bilaterally. I'm going to pull this part of your shirt down and just check your skin turgor. I'm going to pinch the skin under your clavicle. Okay, I notice that the skin turgor is very brisk. Okay, and now I'm going to measure your radial pulses. Okay, that's +2 on the left and +2 on the right. Okay, then I'm going to have you squeeze my hands. Okay, perfect. Hand grips are +5 bilaterally. Okay, I'm going to assess the temperature of the arms and the legs. Okay, so I can tell that the skin is warm, it's dry, and it's smooth on the upper extremities. It is warm, dry, and smooth on the lower extremities. Overall, I can note that there's no signs of jaundice, there's no pallor, and there's no cyanosis present. Okay, as I look at the feet, I'm going to measure the capillary refill of the toes. Okay, less than 3 seconds. Okay, brisk in less than 3 seconds bilaterally. Now I'm going to measure the pedal pulses. +2. Okay, +2 on the right as well. Now I want to have you kind of lift your feet up, pointing your toes towards the ceiling, And then I want you to press down on my hands as you would if you were pressing a gas pedal. Okay, great. So the plantar flexion is +5 bilaterally. Okay, you can go ahead and roll down your pants and your shirt. And then I'm going to have you slide your glasses off. We're going to do a quick examination up here. And if you'll just close your eyes briefly. As I examine the eyelids, I can see that the skin is intact. It is not reddened. The eyebrows, the hair is full, it's thick, it's evenly distributed. And that's the same with the eyelashes as well. I can see that they're evenly distributed. Okay, if you'll open your eyes, I'm going to shine this light in your eyes. Okay, I can see that the sclera is white. The corneas are clear. I'm going to pull down your lower lids. Okay. Okay, the conjunctiva is pink. It's moist. There's no signs of redness or drainage. Okay. Now, if you could just look straight forward at the camera, I'm going to shine this light in your eyes. Just keep focusing straight forward. Okay. The pupils are about 3 millimeters round bilaterally. They're reacting consensually to light. If you'll just continue to look straight forward at that camera, what we're going to do now is I'm going to take my pen light and slowly move it towards your face. When I tell you to do so, please shift your gaze from the camera to my pen light. Okay, let's begin. Okay, shift your gaze. Okay, excellent. So the pupils are equal, round, and reactive to light and accommodation. Now as we examine the ears, I can see that the ears are symmetrical. They're of the same size and shape. I don't see any drainage. I don't see any deformities, redness, or inflammation. There are also no lesions present. I'm going to have you open up your mouth for me. I'm going to shine my pen light in just to examine your mucous membranes. Okay. So on the dorsal aspects of the cheeks are pink, they're moist. You'll stick your tongue out for me. Okay, now lift it up. Excellent. You can briefly close your mouth. The tongue moves freely in the mouth. It's pink and it's moist. It's intact. There's no lesions or deformities. Will you pull your lower lip down for me? Okay. I can tell that all the teeth are present in the mouth. The gums are pink. There's no bleeding. There's no inflammation. The airway is patent. Okay, if you'll lift your head up for me. As I examine the trachea, I see that it is midline, it's center. There's no swelling or apparent deformity. You can put your head back down. I'm going to measure the carotid pulses. +2 on the left. And +2 on the right. Okay, and the next thing I'm going to have you do is stand up and remove your shirt. Okay, as I examine my patient, I can see that the anterior to posterior diameter to transverse diameter, so the anterior to posterior is less than the transverse diameter. The chest appears to be symmetric. I'll have you turn and face your back to the camera. Okay, and then just bend over at your waist. Okay, as I examine the spine, I see that the spine is symmetrical. There's no apparent lordosis or kyphosis, but at the top there may be some mild scoliosis present. Now I'm going to palpate your spine. Is there any pain or tenderness?
No.
Okay. And what about now?
No.
Okay. I'm going to have you stand back up and turn this way. I'm going to move the camera down just so I can see your legs once more. If you'll pull your pants, just your lower pants legs, I'm going to assess for edema of the legs. Okay, so as I palpate the tibial area, I can see that there is no edema present. There is no pitting present. Okay, and now I'm going to have you move to lie down on the couch. So as I stand at the foot of my patient's bed, and I can also come to the side and assess here briefly as well, I can notice that the precordium is symmetrical. There are no lifts or heaves present. The abdomen is flat. I do not see any apparent pulsations or peristalsis of the abdomen. The umbilicus is midline and centered. There's no drainage, lesions, or deformities, and I don't see any redness or swelling. Okay, I'm going to assess your bowel sounds. To do so, I will place my stethoscope on your abdominal area. Okay, the bowel sounds are present and they are active in all 4 quadrants. Now I'm going to do some light palpation of your abdomen with one hand. As I palpate, please let me know if you experience any pain or tenderness. Just a light palpation. No pain? Okay, pain and tenderness absent on light palpation. Now I'll perform deep palpation using a 2-handed technique. Okay, the patient states that there is no tenderness or pain upon deep palpation. Okay, I'm going to have you go ahead and stand up and get back on the chair. Okay, now I'm going to listen to your heart sounds. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Now I'm going to assess the apical pulse for 1 full minute. The patient's heart rate is 84 beats per minute. The rate is regular and even. As I was assessing the heart, I noticed that there were no murmurs present, no adventitious heart sounds. S1 and S2 beats were heard clearly and separately. Okay, now I'm going to assess your lungs. I'm going to place my stethoscope multiple times over your chest and your back. Each time you feel my stethoscope, I just want you to take a deep breath in and out. Okay? Okay, if you'll just spin around for your back to face the camera, We're going to do the same thing. Take a deep breath each time you feel my stethoscope. Okay, if you want to go ahead and face back towards the camera. Okay, so the lung sounds are clear. The predominant breath sound heard is vesicular, so they were clear in all lung fields, and the lung sounds were also present. That will conclude our exam today. Thank you for your time.